Question 18 on health. The Rudd-Watson plan is expected to go before COAG this month. Mr Hodgman, should the Commonwealth Government take over the running and funding of public hospitals?
No. I don't think for 1 minute that Tasmanians living in the most decentralised state in the nation would want health decisions being administered by Canberra. Yes, Tasmanians want and deserve a better, more effective and more responsive health system. And yes, of course, we would welcome better funding from Canberra, but they don't want another layer of bureaucracy standing between them and better health service delivery. I'm more interested in getting decisions on health made closer to home by local communities and rather than expecting that responsibility be administered interstate.
Mr McKinnon.
Absolutely not. We would not support devolving responsibility for our health system from a state level to a federal level. What you get then is people remote from the needs of the community, remote from the opinions of our community, making decisions that have day-to-day impacts on our people. What we need in health, firstly, is more investment in preventative health, investing in preserving the well-being and enhancing the well-being of our people rather than simply responding to sickness and illness. All the research shows you invest $1 in preventative health, you save $10 or $20 in your acute care systems. We need to reimagine our health system to make sure that our people are healthy and our communities are healthy. This will reduce the burden on clinical care. Waiting lists for dentures have gone up from 931 in September 08 to 2,500 in September this year. We need to do a lot more to address statistics like that.
Mr Buckland.
There is no doubt there are major pressures on the health system Australia-wide and major reform is needed. There is no silver bullet in health though, and anyone on this side who tells you otherwise simply is not telling the truth. We say yes to sustainable, technologically advanced health systems, and we say no to a privatisation agenda. We absolutely need to invest from the earliest years in good nutrition for our 0 to 4-year-olds through our child and family health centres. We need to invest in preventative health care, and we need to stop the cost shifting between primary health care, our hospitals and aged care. The way we will do that is by working cooperatively with the Rudd-Labor government to ensure that Tasmanians get the best possible outcomes out of national health reform.
Say yes or no?
It's not as simple to say handing over hospitals, and I would say as simple as handing